According to South Africa Medical Association Trade Union, nearly 800 skilled doctors are still unemployed after completing their medical internship and community service. South Africa, which is dealing with a medical personnel deficit at state-owned institutions, has not engaged these eligible doctors in public health positions due to a lack of money. South Africa is not the only country with a shortage of doctors and nurses. According to a even worse in many other African countries. Chronic staff shortages in the United Kingdom have pushed certain hospitals to breaking point. Now, to discuss further on this, I am being joined by Chairperson of the South African Medical Association, Dr. Mvuyisi Mzukwa. Hello, Doctor, and thank you so much for joining me at this time.
And thanks for inviting me in. Good afternoon to your viewers as well.
All right, you're welcome. Now, Doctor, can you tell us what is the current state of doctors' unemployment in South Africa? How big are the numbers of, unemployed doctors right now?
We are at the moment collating data in terms of how many doctors that are unemployed. But we've already received more than 100 on our database that shows that doctors are not employed, and there are many reasons and that are causing that. And this pertains to doctors who have done their community service. In other words, these are independent practitioners who can work anywhere, according to their registration at the HPCSA.
All right, now you talked about many reasons being responsible for the unemployment of doctors in South Africa. And one of the reasons, as we know, is actually lack of money. Can you give us some of the other reasons?
Well, the biggest one is the budgetary constraints that South Africa is facing. There's been a reduction in the budget of about 1% each year in terms of the healthcare budget. But the other reason is that we've got the problem of leadership and governance. We also have the problem of dilapidating hospitals. And the other problem is that of in the environment, the working environment is not conducive for healthcare workers in such a way that some, they decide to go abroad, or else they go and work in private practice.
Okay. Now, these challenges that you've actually listed, are they widespread, or are they, tailored to specific or certain locations or even certain specialties?
Well, you can imagine that the rural areas are the ones that are mostly affected. Because doctors or the country has not distributed enough doctors and healthcare workers in those rural areas. So those are the mostly affected, but we begin to see shortages of skill even in the urban areas because of the reasons I mentioned before. You will recall that at some point there were difficulties with salaries of doctors, where you find that the doctors, according to our own study, are still earning a salary that they were earning, in 2015 in real terms.
Okay, Doctor, now as the chairperson of the South African Medical Association, can you tell us what efforts are being made or have been made by the South African Medical Association to address this issue and also advocate for doctors' employment?
Healthcare is our responsibility as the South African Medical Association with other stakeholders, but the main person responsible, or the main institution that is responsible, is government. So we work together with government in terms of highlighting these issues. Hence, we have brought to their attention that there's this challenge of shortages, and we expect that they will obviously have a fruitful discussion with other departments, including Treasury, to allocate more resources so that there's enough employment of healthcare workers, especially doctors in the South African hospitals and in the clinics as well, so that, we prepare ourselves for the national health insurance that has been approved by Parliament and other institutions. So we expect that there should be that collaborative talk and also planning that must take place between ourselves and government.
Really hope that whatever it is you're pushing for, gets accepted and agreed to as soon as possible, because one can't even imagine, having the required skills, being ready to serve and not having the opportunity to do so. But you're talking about, not giving opportunities. How does the lack of employment opportunities impact on the morale and well-being of the doctors?
Well, as you can imagine, if you have been studying for so many years and you are keen to serve your country and you've used taxpayers' money, you still have that in your heart that you want to serve the country, but you can't because there is no platform to do so. But on top of that, the greatest challenge is that those that are still employed in government, because of these shortages, they suffer from burnout. They suffer from other issues, including, the conditions on the ground, which you find that they are not conducive, and also, the poor salaries that I was talking about. So it has got a huge negative impact in terms of their morale, and hence you find some of them leaving to private sector or even leaving to other countries. So this is an important issue because it talks to the quality of services that we give to our patients. You can imagine the long queues in hospitals, the backlog in terms of surgeries, the backlog in terms of investigations. So there's many things that are affecting the morale on the ground.
Okay. Now, Doctor, just before we go, while, the association is actually waiting for positive feedback on the policies and also legislations that they've pushed for, what would you say are the possible solutions or even strategies that your association can propose to mitigate the problem of doctor unemployment right now, as of this moment?
Well, we are insisting that we have the Human Resource for Health Plan 2030 that was drafted in 2020. We are calling upon government to implement that strategy. And we are calling upon Treasury in South Africa to allocate more resources, funding resources in terms of employing more doctors on the ground. Because we know that if this does not happen, we know that it's going to affect a lot of quality issues in terms of the healthcare system. So hence we insist that there must be this dialogue, but also there must be this implementation that takes place, so that we serve our patients and we capacitate the healthcare system in South Africa.
All right, well, thank you so much, Dr. Mzukwa, for your thoughts on this particular issue. We appreciate you for your time.